I'll talk a little bit about my philosophy on sleep and circadian rhythm and stress management and essentially how sleep fits into the overall pillars of health. And that's obviously my philosophy, it's my approach. It doesn't necessarily mean it's the only way to look at it or it's the right way of looking at it, but feel free to put up your hand and ask questions at any time. Actually, we can start off right off the bat if anybody has any questions right off the bat that they'd like to get kind of addressed or something that might be right on top of their mind that they want me to key in on, because I do somewhat swim with my lectures, I guess, or my conversations here. So I'm willing to go wherever you guys want to go with this. Yeah.
So in regards to sleep, should the sleep always be, say you're supposed to get 8 hours of sleep.
Yeah.
Is that 8 hours of sleep supposed to be, quote, continuous, or can it be 2 hours at a time?
I love that. Okay, awesome.
6
We're going to touch on that. So yeah, quantity, and if it's grouped or it's batched, we'll definitely talk about all that. That'll be a really good one. Any other hot topics that are kind of top of mind?
I'd be interested in hearing a bit of discussion, I guess, around night sweats and sleep.
Yes, huge one, really good one. Anything else top of mind? Everyone's got some sleep story. Everyone's got something percolating in the back of their mind thinking about, oh, I struggle with this sometimes. Is it okay to struggle with sleep sometimes? Is it always a problem? Yes or no? That kind of is a good place to start. Yeah.
And I probably chat on it, like in an 8 hour recommended, how much of that is like deep REM sleep, and how do you kind of know or track that?
Yes.
Versus like you think you slept good, but maybe you didn't.
Maybe you didn't. Yeah. Who's wearing a wearable right now? Anybody wearing a device that tells them if they slept well last night? I got a terrible sleep score last night, which was the first time in a while. So it's a good day to do this. Talk about it. But there are lots of wearables. There's ways now to track sleep quality and not just sleep quantity. Obviously, sleep quantity being how many hours you're asleep for. And even that's sometimes hard to track because you might be in and out of light sleep and not quite sure if you're awake, if you're dreaming, if you're sleeping, if you're sleepwalking, if you're in paralysis in the middle of the night, or you're mixing between the two. But we'll start with talking about sleep. So sleep, the way that I approach it it's literally the foundation in which all the other pillars of health get to sit in. So if you get your sleep dialed in, and it is pretty consistent, 5, 6, 7 nights of the week, and you feel rested and refreshed most of the days that you wake up, you now have the energy, the motivation, the cognitive willpower to handle the other buckets, which would be considered the pillars of health. So exercise or physical activity being one of those pillars. You're only going to do that if you have decent energy, right? If you have decent sleep, you're willing and motivated to go to the gym and do your morning workout, for example. Another one is nutrition. That's obviously a big reason why a lot of people come to Community Natural Foods, because nutrition is such an important part of health. But how well you sleep impacts not only the types of foods that you reach for, your appetite, your cravings, right? What kind of foods you consciously and subconsciously pick at throughout the day, but also how you metabolically handle the exact same food. So, for example, a really quick example here is patients that have been taken in a sleep lab and restricted their sleep to less than 5 hours, meaning you have somebody in a lab poking you and making sure you never get more than 5 hours of sleep. You wake up the next morning and we do blood tests on you, you'll have the same glucose or blood sugar control as somebody that has pre-diabetes, which is a precursor to type 2 diabetes. And that process can happen with one single night, meaning one night, less than 5 hours of sleep, it impacts your metabolism and your ability to handle sugar that next day. So, and it's such a profound effect that it not just regulates your blood sugar, but that blood sugar spike and excursions that'll go up, down throughout the day can impact mood, can impact what you end up doing throughout the day from an energy perspective. What do you need to do now? So you need to take another coffee at 2 or 3 p.m. All that kind of stuff could be related to just having metabolic impacts from one bad night's sleep. So there's exercise, there's nutrition that goes into that bedrock of sleep. There's obviously the stress and the resiliency to stress. Everyone here has had a bad night's sleep and been really cranky the next day, right? A little bit reactive, a little bit, not as chipper, not as smiley, not as fun to be around. and simply just because of one or two bad nights sleep in a row, right? And so stress and your resiliency to stress is really impacted by sleep. And of course, social engagements, of course. So for me, my other pillar of health is social health, right? So it's your ability to communicate with others and to enjoy the interpersonal experiences that you have with your family, your friends, your colleagues, and your neighbors, right? So if you can get sleep dialed in, it doesn't have to be perfect, but it has to be there. It has to be paid attention to. It has to be a topic of concern that you pay attention to, as opposed to just going 100% laser focus on your diet, and then just, I don't really think about my sleep diets. It happens in the background. Or 100% focus on exercise, right? And you're getting all your workouts in, and you're going to your HIIT classes, and you're going to your spin classes, and you're getting your walking in, and you're doing your squats. But you're not recovering, you're not adapting, you're not getting the benefits of the stress of that exercise because you don't sleep enough to get the restoration that you would get, right? So sleep, obviously, is that period of time we're unconscious at night. It ranges between about 5 hours and 10 hours of sleep. It's what's considered normal. The 5-hour group is really rare. Like, how many people in here think that they're a 5 to 6 hour sleeper? Yeah? Okay, that's like half of us. So statistically, it's less than 1% of the population can get away with 5 hours of sleep a night. And it's a genetic thing. You either were born with it or you weren't, and you've been like that since you were a kid. You were always the kid that didn't sleep as long. You were fine with early morning school days. You could stay up late playing video games and get away with it. Those people are blessed in some way, right? The vast majority of people fall into the camp where they need somewhere between 6 and 8 hours, and ideal health is somewhere between 7 and 8 hours of sleep per night. And that, really importantly, is time sleeping, not time in bed, right? So time in bed does not equal time asleep. And in fact, there's not a correlation at all there. You could be in bed, we call it bed rotting. Has anybody heard that term? Bed rotting? No. It's common where people are on their phone, they're in bed, and they're doing everything except for sleeping. They're snacking, they're watching a show, they're scrolling on the phone, they're talking to people on the phone, they're doing chess on their phone, they're doing something, but they're not sleeping. So they're in bed, rotting, and they're not getting the benefits of sleep. And there's actually two problems with that. One is you have no idea how much sleep you got, right? So you just kind of fell asleep at some point. And you woke up feeling, maybe you woke up the next day not feeling quite as refreshed as you thought you should because you were in bed for 12 hours or you're in bed for 10 hours, right? And then number two is you start to associate the bed with other activities that are not sex or sleep, right? That's where the only two activities that really should be happening in that location of your house. And so that's two things. So trying to get an idea of what feels good for you. Most people fall in that 6 to 9 hours of actual sleep time, which if you were to just back of the napkin math this, that means you're at least at 6.5 to 7 hours of time in bed because you probably aren't sleeping. You're probably sleeping about 85% of the time you're in bed. And that's assuming you fall asleep pretty well. If you wake up in the middle of the night to go pee, for example, you wake up and you fall back asleep pretty easily, and you don't struggle with waking up, or you don't struggle with staying up. So if that's you, 85% of the time that you're in bed, you are actually asleep. That is a good percentage. And then if you also can get that total amount of time in bed, around that 7 to 9 hours or 7 to 8 hours in bed, then you're probably hitting that sweet spot. So that's averages, right? Nobody in this room is actually perfect average. You're all individuals. So you really got to figure out what works for you. And there can be a dramatic difference in how you feel with simple 15-minute increments sliding of how much sleep you're getting. Or 15 minutes on either side of essentially getting a little bit too much sleep and getting a little bit feeling you're a little bit too groggy in the morning, or 15 minutes a little bit not quite enough sleep, and then again feeling groggy in the morning. So there's a sweet spot for most people. And it's impossible for us to know this unless you're either doing sleep tracking or using sleep diaries. And you're very consistent over a long period of time, right? So that's the starting point, is how much sleep am I getting, or how much time am I in bed? Do I have a difficulty falling asleep? Do I have a difficulty staying asleep? And then how do I feel in the morning, right? One of the first things I ask my patients in the clinic is, how do you feel 15 minutes after waking up? Not immediately after waking up, that's not a fair argument, right? You gotta get up, get the joints moving, get some blood flow. So 15 minutes after you wake up, how many people in this room feel good? 15 minutes after waking up. Decent? Yeah, and then the second question to that is, okay, how many days a week do you wake up feeling good, right? Because some days, maybe you do feel good 2 days a week, 3 days a week, 4 days a week. So what I'm looking for is 5 or more days a week. You wake up feeling ready to tackle the tasks of your day, motivated, right? If you have things on your schedule, you're ready to do them. You're obviously not waking up feeling too groggy or too tired to do them or too low mood or just depressed to do them, right? So that's the foundations. Where are we at right now? How much sleep are we getting? How much time in bed? How much sleep are we getting? How do we feel in the morning? And then there's one other question we ask from a medical perspective that tells us a lot, and that's daytime sleepiness, right? So if you struggle with daytime sleepiness to the point where if given the opportunity, you could take a nap, that's significant, right? It's not just the slight lull you get after lunchtime, right? That's very common at 2 to 3 p.m. You get a lull in energy, but not necessarily to the point where you could fall asleep. That's pretty normal from what's called a rhythm or a circadian rhythm standpoint. But if you're getting daytime sleepiness to the point where you can take a nap more often than not, even if you wake up feeling refreshed and you get enough sleep at night, that is an indication that we need to dive deeper, right? So it's the number one indication for us to refer out to sleep labs to do any type of sleep study. Okay, has anybody here done a sleep study where you go into a lab and they put all the leads on you? Nobody? Yeah? The sleep studies, if you go, there's 2 different versions of it. The one that's most common is they send you home with it's a sleep apnea test essentially. And so you're sleeping in your own environment, got a couple of leads on you. It's not super invasive, but what they're looking for is how often do you stop breathing at night, or how often does your oxygen saturation in your bloodstream drop, right? And what they're looking for is the most common sleep condition called obstructive sleep apnea. And if that is positive, it's a very clear treatment pathway, right? There's no more question marks as to what's going on. You go get the treatment for that. If that treatment is done well, you feel like a completely different person, right? The other sleep study is way more fun. You go into a lab, it costs a lot more money, obviously. You go into a lab, people get to watch you sleep all night, right? No, they put leads on you, they're behind that glass, and they get to, basically they read not just your oxygen saturation and your temperature and the like, but they also read your electrical signals in your brain. And you can see very clearly if you're going into sleep, but not just any sleep. You can also see if you're in light sleep, deep sleep, REM sleep, and then how often and how long you stay in each one of those phases. So that's the true only way to answer your question a little bit. The only real way to get accurate data, 100% accurate data, is to do what's called the polysomnogram, which is that in-house sleep study, or in-lab sleep study, I should say. And they're measuring brainwaves directly. And they can see very clearly, okay, you slept for 7.5 hours. A really great score would be somewhere between 1 and 2 hours of deep sleep and 1 and 2 hours of REM sleep per night. And then the rest of that is considered light sleep. Okay, and it's important for the clinician to know that, because it can tell us a little bit about the underlying diagnosis if you have a primary sleep disorder, right? A medical reason for your difficulty with sleep. But most people who struggle with sleep do not have a primary sleep disorder. The exception to that is the obstructive sleep apnea, but those are actually getting easier and easier to test and easier to treat. So the sleep apnea piece is one part, but most people go into the sleep labs, they say, you don't have a primary sleep disorder, but you're not getting a lot of REM sleep, or you're not getting a lot of deep sleep. Very commonly, it's you're not getting a lot of deep sleep, so you're a very light sleeper, right? Anybody in the room a light sleeper? Light sleeper, yeah, it's like the same people that get sleep tests done, right? Light sleepers, obviously, the world is a little bit more challenging because every little noise can wake you up. You're more conscious of your environment every time you come up into light sleep. And so when you're in light sleep, you literally are, so you're asleep, so you're not paying attention, but a part of your brain screens your environment for threats that might be important for you to know about. So you can imagine as a hunter-gatherer, if you're on the savannah and you go into a light sleep, you can screen for any little noise that might be a reason for you to wake up. You can wake up, oh, it's nothing, just some wind, whatever. You can fall back asleep. But when you fall back asleep, you often will end up going back into a light sleep again just to screen the environment. So what happens is your body will force most of the deep sleep, where you're not responsive and you're not able to do anything, and you're actually getting some recovery, into the first part of the night. And then the rest of the night, you cycle between light sleep and REM sleep. Light sleep and REM sleep. And REM sleep is just rapid eye movement sleep. It's really where you're dreaming. Your body is, it's really for memory consolidations, for making your brain filter the yesterday's memories and figure out what's important, what should I keep, what should I not keep, how does this relate to previous experiences, what should I make this person anxious about when they wake up, like those kind of things. So the brain is highly active, but it's also very aware of its environment during that process. Yeah.
When you look at like an athlete side, you're talking about different heart rates, like a resting heart rate.
Yes.
So someone with a lower, even during the day, just a super low resting heart rate, and then they go into sleep.
Yeah.
When you get that low heart rate, is there a change in their quality of sleep? Because you're already at this low rate.
Yeah.
Maybe there's no obstructive sleep apnea. Second point to that is like, is the sleep apnea based on position or happens no matter what, side, back sleeping?
Yeah.
But again, starting with a low heart rate, is that affecting sleep quality in general?
It shouldn't. No, it shouldn't. So there's a couple of caveats here. If you have anxiety or you struggle with basically the exact opposite of what you just described. So athletes will often have low resting heart rates. Their nervous system is very flexible. It's able to be aroused and agitated, and then it's also able to restore and go into the rest and digest mode. And sleep is obviously the ultimate expression of rest and digest. So the lowest heart rates in the day will take place when you're asleep. And in fact, that's one of the primary things that's being tracked when you use a device that's tracking your sleep. It's watching your heart rate, and it's watching your heart rate do that oscillation. And as it goes lower and lower and lower, it often means that you're getting more into a deeper sleep. And of course, the tracker you wear 24/7 also knows your resting heart rate during the day. It knows your resting heart rate, or your heart rate when you're exercising. So it can tell the variance or the difference between those two, and it can indicate whether or not your sleep was restorative or it was not restorative. So that's one piece of the pie. The restorative sleep, the sleep trackers in general are like 70-ish% accurate at the best of times. So that's your Whoop bands, your Oura rings, if anybody's interested in looking at them. Those are the two most accurate devices. So the Whoop band, W-H-O-O-P, I'm not affiliated with any of these guys. And then the other one's called Oura ring. And they're the most accurate sleep trackers, but they are not perfect. So they're fairly good in terms of sleep duration, so how long you're asleep for, and waking up in the middle of the night. But they're not they're not as accurate for whether or not you're in REM sleep or your deep sleep or your light sleep. Right? Then to answer your question about the sleep apnea piece, it's very positional, but not always. So most people that have sleep apnea, it's worse when they're on their back. It's worse when they have gained weight. It's worse when they've had alcohol. It's better typically in a sideline position or a front or belly sleeping position, or mostly the sideline position. But some of that's it's out of your control. Like your body, for the most part, is going to be going from position to position throughout the night. That's another thing that's tracked during a sleep test is how long do you spend on your back, how long do you spend on your side, and they'll tell you if you stop breathing at night or you're snoring at night, it'll tell you exactly. Are you only snoring when you're on your back? Okay, this might be something that we can fix just with putting some pillows under your shoulders or changing the type of bed that you have that positions you in a different way. That makes it harder for you to sleep on your back, for example. Pillows for the knees, pillows for the shoulders, that kind of stuff. So the position ends up being a big part, but it's not the only part. The populations I see the most sleep apnea are the bodybuilders and the overweight patients. So bodybuilders, very common. They have excess muscle that they've gained basically in the upper neck, and they end up having a pressure sensation. So they lay on their back, they get a little bit too much muscle pressing down on their airway passages, and then they stop breathing, and then they have these gasping fits in the middle of the night. And then you have other patients with the same problem for a different reason, right? Those are the two most common. But it's possible to have sleep apnea if your body happiness is very normal, meaning that you don't have excess weight or excess muscle, so it's still possible. Yeah.
Can you have sleep apnea and not know?
Absolutely. Absolutely. Most people who have sleep apnea currently do not know. The signs of sleep apnea that might do some things that might trigger you to go get it tested are blood pressure that's difficult to control, even if you're doing all the right things from a diet and exercise perspective. If your blood pressure is still not in the ideal range, it could be related to an undiagnosed sleep apnea. Atrial fibrillation, which is a heart arrhythmia condition, is very often related to sleep apnea, and it goes both ways, meaning that you can have sleep apnea and you're more likely to develop bad arrhythmia and vice versa. So those are two most common ones, and then of course the subjective ones, meaning like I'm fatigued, but I'm used to being fatigued. It's my new normal, right? I have sleepiness, but I always take a nap, so it's okay. You know, and it ends up being people adapt to their normal, and they may not know that there's some underlying pathology that's worth looking into.
So would you say somebody who has sleep problems and has never been tested or anything would be advised to get a sleep apnea test?
Yeah, I have a low bar or a low threshold for my for when I go and ask for a sleep study, right? So I will recommend that through your doctor. Fairly, like if you struggle with fatigue in the morning, if you know you have difficulty with sleep or you know you have difficulty with high blood pressure, I just say let's go get it done. Because it's not, if it rules it out, great, it's one thing you don't have to worry about, right? And that in and of itself can help with sleep, right? One less thing to worry about can help with sleep. Yeah. But yeah, so I would say those are really important. The sleep, anybody nap here? Does anybody nap? Yeah. Daily, weekly, monthly? Daily. Okay. And when did you start doing that? Was that later in life? Was it postmenopausal? Was it?
Yeah, later. It's been
Yes.
5 years.
Okay. Sleep. So napping is interesting because napping is healthy in a short-term setting. So meaning that if you take somebody and you get them to nap, and then you wake them up and you test them anyway, athletically, physically, they have better performance. Cognitively, memory-wise, they have better performance. Mood, emotional regulation, they have better performance, right? Naps seem to help in the short term. The time where naps can become a problem is if you have to use them every day and you're covering up for a primary sleep disorder, right? So you're getting that tested is one. And then number two is if you're taking a nap and it impacts your ability to sleep that night, or it changes how much time you get at night asleep, that can be a problem. And that kind of goes to the question earlier, which was, does it matter if all of your sleep is all in one bunch or if it's broken up into two? We call it, if it's in two, it's called biphasic sleep. So you have one nighttime sleep and you have one mid-afternoon sleep. It's not completely unheard of to do that, and there's some pros and cons, but the primary benefit to having monophasic sleep, which is all of your sleep is at night, is that you will get more total deep sleep and more total technically restorative REM sleep. And the benefit of that is hormonal. So typically you're getting more of a hormonal response and a brain health response in deep sleep. So is anybody familiar with the association between sleep and dementia or memory concerns, Alzheimer's?
Makes it worse.
So so primary insomnia, sleep disorders, and people that just have low sleep durations have higher rates of dementia and Alzheimer's disease. And the primary reason for that is because during deep sleep is when your brain washes itself. Literally, there's something called the glymphatic system in the brain that will flush and wash the metabolic waste out of the brain and back into the circulation, so go back to the liver, you get it out of the body, and you can urinate it out. So it's a really, really important process that primarily only takes place in deep sleep. Okay, so if you have somebody that's sleeping 5 hours a night at night, and then they sleep an hour and a half in the afternoon, the 5 hours at night they're probably getting 1 hour, maybe 1 hour of deep sleep, and then in the afternoon they're getting 0. So that nap, you're almost guaranteed to get 0 deep sleep during that nap in the afternoon. So you're kind of trading a little bit, you're kind of stealing from Peter to pay Paul, right? And the problem there is more so not about how you feel, but it's about the long-term risks that you might not be aware of, right? But if you nap every day and you still fall asleep easily and stay asleep at night and you feel refreshed in the morning, no problems. Zero issues with that.
What's the minimum percentage of people sleep
The percentage, it's roughly it's around 20% of your total sleep time should be deep sleep. And again, the only way you really know that is if you go and get a polysomnogram, which is a lab test, right? And you didn't have a lab test for sleep study. But the sleep trackers will give you an estimate on that number. And so most people at 20% ends up being an hour and a half-ish. That's a pretty good number. Yeah.
You have a really good nap sometimes, like you're exhausted, you have to take that nap, and fall asleep quick. You wake up, it was an hour, but you feel like way different than your night sleep. You feel like it was like you slept and it's like 11 when you wake up at night. You feel like you have a deep, is that a deep sleep? Like where you just think like that 1 hour was like 10?
Yeah.
Is that
maybe in that case, it's hard to say. There are examples. Like the way that I'm talking is more in terms of generalities and averages, right? So you can imagine there's an example where you maybe just got off of a travel, or you did a marathon, or you did some sort of a big event, and then your body is craving some additional recovery time, and you can feast on high quality sleep in a small window. There's lots of examples of that. It's actually very common with people that have several nights in a row where they have to stay up or they don't have good quality sleep because of work, shift work, various types of emergency situations, right? And then they end up not necessarily making up for it 100% in the week to follow, but they'll have a higher percentage of their total sleep time for their next sequential amount of sleep will be higher percentage of deep, higher percentage of REM sleep. So you're kind of making up for some of it. Like your brain is feasting for it because it feels like it needs it, right? The other thing that happens is anybody, alcohol. Anybody drink alcohol? Yeah, okay. So alcohol is something that's like very commonly used to help people sleep, or people will self-medicate with it because it's a sedative, right? It calms the brain. So if people struggle with falling asleep because their mind is really active, they have a little bit of anxiety before bed, or their mind is really active thinking about the work or travel or some conversation that didn't go well or whatever, alcohol is a sedative, so it can kind of take the edge off a little bit. And people will associate that with having an improved sleep, right, or improved sleep quality. The problem with that is that it interferes with the quality of the sleep to the point where you will not be able to get into REM sleep. And REM sleep, I talked a little bit about that, but that's where you get the cognitive benefit, the memory benefit, consolidation of emotional regulation. A lot of that happens during REM sleep. So you don't get as much of that if you're constantly using alcohol right before bed. And what can happen, and you see this with alcoholics actually, is where they will start to have, their brain will crave REM sleep so much because they have been artificially prevented from getting it for so long. This happens obviously with alcoholics because they're having high amounts of alcohol all the time, including during the day. They get to a point where they're going to start getting, they have actual REM sleep episodes when they're awake, which is called delirium tremens, which is a very interesting thing. It's like a form of REM sleep while they're actually consciously awake, which is wild. But it just tells you your brain does have a pressure for all these things. It's kind of keeping track, and it knows when you need a really restorative hour, right? And those can be a blessing. Yeah. And I don't want to be like, if you don't think you have a sleep concern, overall, like I said at the beginning, you're getting that 7 to 9 hours, you fall asleep within 30 minutes, you wake up feeling refreshed most days, and you sometimes nap. There's no problems, like 0 issues, like no problems whatsoever. I want people to come out of here and be like, oh, I said no napping, don't nap. That's not true. I want you to feel like you can nap and it can be useful. It's just you don't want to have to rely on it, and then it affects your ability to fall asleep at night, which is quite common. You guys say something?
I have a question going back to what somebody said a few minutes ago with regards to the sleep apnea.
Yes.
If you are a person who has to sleep on your back.
Yes.
I've been trying to adapt to the sleep apnea machine.
Oh, yeah.
But I have a problem that as soon as I'm going into deep sleep, like I have a low heart rate, low blood pressure. I think my heart rate goes down so low that I breathe really slowly, and that's being interpreted as not breathing. But I am actually breathing out for a long time.
Yeah.
So what's actually happening to me is that then when I begin to breathe in,
Mm-hmm.
it's like I let the pressure of all that air that's trying to be forced at me blows up in my face,
Right.
and then I can't fall asleep.
Right.
And if that happens, I won't sleep for the moment.
Mm.
So, like, could low blood pressure and a low breathing rate
Mhm.
be mistaken for sleep apnea?
I don't know about the blood pressure. I'd be surprised about the blood pressure, but the breathing rate potentially. It depends on the settings and the device and the mask that you're using. I'm not a sleep physician, so I don't actually help people with the manipulation of their CPAP machines or their APAP machines, but I am the one just referring in, helping them get that, making sure that they're aware of it, right? So I would say talk to the prescribers, whoever prescribed that and whoever set you up with that about alternatives there. The devices should tell you how often you're breathing, meaning like how many breaths per minute. And a normal amount during sleep is 6 to 8 breaths per minute. So if you're down at 3 or 4 breaths per minute, that might be an issue. So bring it up, right? It's something that if you have a theory about it, you might be onto something, so it's worth talking about. But I can't answer it directly because I don't know the machines well enough. Yeah. I don't know if they're building up too much pressure. That would be an issue for you, but I'll open it up actually to some more. I would like some more direction as to where you guys would want me to go with this conversation, because sleep, again, it is pretty broad. It impacts health in a lot of different ways. I assume, come to community natural foods, there's questions about supplements and melatonin and dietary pieces and maybe exercise or baths or hot or cold. And is there anything in those topics that kind of comes? All of those?
Night sweats,
Night sweats, that's right too, yeah.
How to get your brain to basically shut up.
That's
Yeah.
a whole other set.
Yeah.
Melatonin.
I will touch on the active brain really quickly here, because it is it's the most common non-sleep disorder. So no, it's not a primary sleep disorder, but it's the most common reason for difficulty sleeping. And so an active brain can take a lot of different flavors, I would say. A lot of people have it in a way that's very distressing to them, and maybe it's related to clinical anxiety, and maybe it's not. A lot of people, it's just when they lay their head down, their brain reminds them, oh, you're finally relaxed. Let me tell you about all these things I need you to do. And a lot of this has to do with things that we know our brain wants us to address during the day, and we didn't give ourselves the opportunity to address it during the day. So obvious examples of this that are hard to change are like conversations with loved ones that didn't go well, or conversations that you want to redo, or hard conversations you're not sure about how to have. So the social department. The ones that are easier to deal with are the run-of-the-mill, like checklist item, the things that you feel like you have to get done that your brain is just reminding you about, right? Like, oh, don't forget about this in the morning. Don't forget about this in the morning. Don't forget you got that alarm that's going to go off, 2 hours earlier tomorrow. So you should probably fall asleep right now. Then all of a sudden you can't fall asleep, right? And so there's an entire therapy called CBTI, Cognitive Behavioral Therapy for Insomnia. It's an entire system that is designed. Cognitive behavioral therapy, if anybody's familiar with this, is the association between your thoughts, your feelings, and your behaviors. And there are so many levers to pull here that have a direct impact on sleep that they've created a subfield called CBT, insomnia, CBTI. And it is the most effective therapy by far, like not even close, the most effective therapy by far for sleep concerns. So that more effective than any supplement, more effective than any medication, more effective than any sleep hygiene related therapy, is the most effective therapy bar none. And it does not matter what the cause of your insomnia is, exceptions being ones that are mentioned, like sleep apnea, restless leg syndrome. But the therapy is the same every time, okay? And that entire approach is about how do I set myself up for success so that when my head hits the pillow, I don't have that racing thought or that anxious thought or that active mind keeping me up at night, or I'm not associating those things with my inability to sleep, which is that vicious cycle, right?
Just an therapist talking or?
It's usually done by a therapist, yeah. Usually done by like a counselor or a therapist. There are I would recommend Googling that and finding a therapist or a clinician near you to at least have a conversation. It's often done in groups, to be honest, and it's very affordable and easy to do. The reason it can be done in groups is because therapy is the same, regardless of why you're there. So they just need you to go through the process, and the process takes 8-ish weeks. And then you usually have a completely different association with sleep, an association with your bed, an association with what's good, what's not good, what's normal, what's not normal, what you should be concerned about, what you should not be concerned about.
How many weeks do you say?
8 weeks. Yeah, typical CBTI. Of course, there's different therapists do different approaches, but that's the common one. And there's a lot of things that I recommend in my office that is 100% stolen from CBTI. Because there's so many things that work in that department that I've just stolen parts of them that I like to use in my practice, but I'm admittedly not doing the entire program, so the entire program is superior to what I would do in the office, right? Of course, in the office, as naturopathic doctors, we're talking about everything, right? So we don't always have the luxury of just being like, we're going to spend an entire 90 minutes talking about your sleep and your sleep structure and your habits and your associations and what you're thinking about and all that stuff, right? So this is where the collaborative care really comes in. But, so that's one piece. I'm going to circle back to temperature regulation, okay? One part of sleep I didn't talk about, it might be going over here on time. What are we doing on time? Oh, we're really? Oh my gosh, okay. Okay. One of the most important pieces of sleep is what's called the circadian rhythm. Has anybody heard of the circadian rhythm? Yeah, a lot of nods. Okay, so the circadian rhythm is just your biological clock. Every system in your body has a clock, and the master clock is in your brain, and the most important thing it regulates is your core body temperature and your autonomic nervous system. So your core body temperature is going to have a high point of the day, and it's going to have a low point of the day. And the fluctuations of that temperature is biologically driven on a clock, okay? And the most important thing about sleep is the initiation of sleep is when your body starts to cool down. And helping yourself cool down can really help essentially enshrine that process and reinforce that process. And then your core body temperature should still go down throughout most of the night. 3 to 4 in the morning is typically the lowest point in most people's cycle. And then it starts to slowly come up. And as it kind of starts to come up, you're going to start to get a rhythm of hormones that'll help you start to get up. You can get awake. So there's something called the cortisol awakening response, which is one of the most common functional tests that I order in my clinic, is a cortisol awakening response test, because it can tell me what is going on with the biological circadian rhythm under the hood, right? And that should be related to when you feel alert, when you feel sleepy, when you see light, when you don't see light, when your core body temperature is high, when it's low, when your blood pressure is high, when it's low, when your heart rate is high, when it's low. Essentially everything in your body is going to be linked to that rhythm. Core body temperature, if you, let's say, go through menopause and you have issues with all of a sudden heat flashes or hot flashes, or for any other reason you're getting hot flashes or night sweats, that is a huge disruptor of sleep because you're getting a surge in temperature when you should be going in the opposite direction. So there's 2 problems with that. Is it'll wake you up and you feel uncomfortable, you might need to change your sheets, literally. That's the definition of night sweats, is you have so much sweat that you either need to change your sleep garments, like your pajamas, or the sheets themselves. And if you're having that, you also disrupt the cycle, the circadian rhythm, so much that you will feel distressed and you will wake up and it'll be difficult to fall back asleep. And so it's a vicious cycle, right? So these are called vasomotor symptoms, the hot flashes associated with menopause, are not driven because of the sleep problem or because of the circadian rhythm problem, but they make those things worse, right? So they need to be treated independently. Talking to your doctor, your naturopathic doctor about hot flashes, because hot flashes or vasomotor symptoms of menopause or perimenopause can be addressed, can be adequately treated, and then once those are gone, they stop interfering with your sleep. Okay? There's other things though that people do inadvertently that can throw off temperature, that can throw off sleep. The most common of which is exercising really late before bed or eating a big meal right before bed. Both those two things, especially if it's a high intensity exercise or very stimulating exercise, that will increase your core body temperature, make it harder for you to cool down and initiate sleep and stay asleep. And then also eating a meal before bed takes calories to absorb calories. So you will burn, you will create heat by digesting and absorbing that meal, and it's a bigger meal, it sits in your stomach for a longer period of time, that'll have more of an effect on your core body temperature, and therefore your sleep quality and your rhythm as well going forward.
I found that if my brain is motoring for a long time, if I go and eat a piece of toast, my brain has something to do.
Yeah, it's paying attention.
It's paying attention and it's digesting the toast or whatever.
Yeah,
And it works.
it works.
Yeah.
You gotta find what works for you, right? There is a lot of individuality and nuance with especially sleep because there's such a strong relationship between the brain and the body. Obviously, sleep is driven by the brain. It's like forcing your body into a coma. You're forcing your body to not do anything. So your brain is so powerful. So anything that's going on, above the shoulders is going to be important. And that includes not only what you're doing, but how you think about it, how you associate with it, right? Oh, my brain is now focusing on doing something, and therefore it's not ruminating. Some people would use TV. Who does that before? Who watches like some TV show that they've seen a million times? Yeah. So that's a very common technique, and it does work. And the reason it works is that not saying you have to do this, but it can work for some people because your brain will be paying attention to something it doesn't really care about. It kind of knows. It's not uncertain. It's no unpredictability. It's like something they've seen a million times. And it helps offset the conscious awareness of the spinning rabbit wheel, right, or the mouse wheel that's just moving. So ideally, that's not a really bright screen right in front of your face as you're sleeping and a really loud, stimulating TV. But if it's like you're watching, the classic is like Friends or something, and it's in the background, and it's just playing. Brooklyn Nine-Nine is a classic. Like you just end up, it plays, it feels like I don't care what happens in the show, it goes on, that's fine. It's a lot different than like scrolling on your phone or answering emails or something like that. Light exposure. So temperature exposure, I mentioned a little bit about that. You can manipulate this in some direct way where you take like a warm bath. Who likes to take a warm bath before bed? Or a warm shower? Anybody? A couple, 3 hands? That's a really nice technique. You can also do this just by warming up your hands and your feet too. But a warm bath or a warm shower 30 to 60 minutes before bed makes you essentially, as soon as you get out of that shower or you get out of the bath, your body will very quickly try to cool you down. And that cooling down, that active cooling down process will help shift you into that sleepiness state and help you fall asleep easier. The opposite is true in the morning. So really short cold exposure in the morning, like a cold rinse at the end of a warm shower, which is a really common thing. And you'll see people doing cold plunges and other variations of this. But a short burst of cold within the first hour of the day, ideally within the first 30 minutes of your target wake-up time, is a really great stimulus to basically anchor the circadian rhythm at that point of the day, so that 16 hours later, you're going to have the opposite take place, right? It's about consistency. I should start with this. The most important thing with sleep is consistency. And the most important part of consistency is the morning consistency. Morning. What you do in the morning that sets yourself up for a success that night. So a large amount of light exposure. Right now, we're blessed. Pretty much anybody waking up, you can go outside, it's going to be bright out, regardless of the day, of the time of the day. If you can get a large amount of light exposure, natural light is ideal, but in the winter you can use bright light lamps, bright light therapy lamps, happy lamps to manipulate this. If you get light exposure the exact same time of day, you will anchor your rhythm so that 16 to 18 hours later, you're going to start to have melatonin go up, you're going to start to get sleepy and tired at the right time. So what you can control is when you wake up. What you can't always control is when you fall asleep, because how tired you are, how stimulated you are, what happened during the day, a lot of that is not in your control. You just need to listen to your body at night for when you're tired. You should listen to your body when you go to bed. Don't go to bed when you're not tired. Don't go to bed because it's a time of day. Go to bed because you are tired, and then you wake up because you want to wake up at that time. That makes sense. You be militant in the morning and you feel more laissez-faire at night. You kind of grip a little less at night and you pay attention in the morning. So light exposure, really, really important. First thing. Then at night, the opposite there is true, where you want to minimize how much excess artificial light exposure you're getting late at night. And this is, again, admittedly a little less important here in the summer. Who sleeps less in the summer than in the winter? Anybody here? Yeah. It's really common, it's biologically normal for you to sleep less in the summer than it is in the winter because of the light rhythms here in Canada. So you will not have the same amount of melatonin surge if you try to go to bed at 9 p.m. tonight as you would at 9 p.m. in December, right? Simply because it has been dark at 4 p.m., 4:30 p.m. And so you're getting a melatonin surge at like dinner time, and then you're ready to sleep at 7:30. And that's a normal biological clock, but you're not getting the darkness here until 10:30. So you kind of have to artificially create that, which is something I would recommend if you want to stay on a consistent sleep schedule because you have a consistent work schedule and a consistent life schedule, right? But hunter-gatherer societies would just go with the flow, meaning like you sleep a little less, that's okay. You sleep a little more in the winter, that's okay too. Yeah. Supplements, medications, anything in that department have specific questions on? I'm a little bit mindful of the time here.
The things with melatonin that people use, and does it disrupt or?
Yeah, melatonin.
Like,
So melatonin, couple of things to know about it. Melatonin is a hormone. Your brain is producing it naturally. Every night should be. The amount of melatonin your brain produces is somewhere in about 0.5 milligrams, maybe up to 0.75 milligrams total. So it's really, really small amounts. So if you take a supplement and the supplement says 10 milligrams on it, that is a huge dose. And it's such a huge dose that you will still have most of it in your bloodstream when you wake up. So you still will feel groggy in the morning because you have more melatonin than you should have when you wake up, right? Now, light exposure, moving, cold exposure in the morning, all that can help flush out some melatonin so you can get around that in some capacity. And there is use cases for high-dose melatonin in integrative cancer care. It's anti-inflammatory, it can be helpful for pain management, but it is not, high-dose melatonin is not used for sleep. Low-dose melatonin is what you want to look for if you are looking for it at all for sleep. And it's 0.5 milligrams to 3 milligrams is typically the dose in that for melatonin, and you want to go as low as you can get away with, essentially. So the lower you go, the less chance that it can affect your own biological
How do you know
production
that
as
you
well.
need to take melatonin?
Melatonin is something that I personally would recommend talking to a naturopathic doctor about. I would say talk to your doctor about it, but most medical doctors probably wouldn't be up to date on it. So first thing, melatonin, you need to get a good brand because melatonin, and of course, community's got lots of good brands here, so you want to buy it from a reputable source because there's a big problem with dosing. Like it says 3 milligrams on the bottle, but it's actually 10, or it's actually 0.3. So there could be a 10-fold difference in what's on the bottle. That's not the case for a lot of the good brands. Obviously, they get third-party testing, but melatonin is often when you need it. I often most prescribe it for people that have circadian rhythm or shift work. So circadian rhythm disorders where they're not producing their own melatonin at the right time because of life circumstances, shift, or travel. Those are the two most common. Really, really small amounts, like I said, can be helpful for pain and anxiety as well. So there is a use case there, often combined with a couple other nutrients. So common combination in the supplement world right now is taking melatonin, a small amount of 5-HTP, and a small amount of L-theanine. It's a pretty common formula right
Can you say
now.
this again?
L-theanine and 5-HTP. And they're used together because 5-HTP helps you produce a little bit more melatonin. It's a precursor to melatonin. And L-theanine is it's like an anti-caffeine. It kind of takes the edge off, kind of like how caffeine stimulates a little bit. It's literally, L-theanine is a component of green tea. So the reason why when you take a green tea or you have a matcha latte, even if it has quite a bit of caffeine in there, you don't feel that buzz you would get with coffee. Right. Yeah. So there's still a lot of caffeine in matcha. I'm not saying you can get away with that, but L-theanine is extracted from from green tea, and it's often put in a supplement form, and it's one of those supplements that is more useful for the active ruminating brain, and it's often combined with a little touch of melatonin and a little bit of vitamin D.
Is L-theanine the one that's the blood-brain barrier?
It does cross the blood-brain barrier. There's a lot of supplements that don't cross the blood-brain barrier or shouldn't, right? So a classic one that's often used is GABA. Anybody heard of GABA? So GABA is often used for anxiety. You can use a little bit for sleep, especially if anxiety is affecting sleep. But it shouldn't cross the blood-brain barrier, but in some people it does. So it's one of those things.
So
It's
that's bad
individual.
if it crosses?
Sorry?
Is that bad if it crosses the brain?
It's we don't know. We don't know. We just theoretically it shouldn't get across, but in some people it does. So L-theanine often bypasses that because it gets in the brain really well.
Is it usually combined with magnesium?
Magnesium is almost always done separately, but a lot of people will start with magnesium and then they'll add those things on after. Magnesium is a great place to start because it's so non-toxic, it's so safe. You can find reputable brands, you can get doses that feel good, and it might help with your sleep, right? It might help with muscle relaxation if you struggle with like restless leg syndrome or cramping at night or muscle spasms or your feet kind of spasm or difficulty with blood flow and concerns there. Magnesium can be helpful. And usually it's magnesium glycinate or a 3-in-8 version, and it's not the other ones. The other ones are typically better for constipation and things like that.
Sorry to keep bringing us back to it.
Yeah.
Night sweats.
Yes.
Years past menopause.
Yes.
Why suddenly and consistently every night?
Yes.
I
I can't answer that. I wouldn't literally be able to answer that. It would have to be a conversation about going into a little bit more detail there, and also getting some labs done. To be honest with you, not a quick answer. It's not uncommon. That's all I'll say there is that it's not an uncommon concern, and it's not uncommon for males to deal with it too.
It's not uncommon.
Uncommon for males, for men to deal with night sweats as well. And I hear a lot. I see a lot of men's health in my practice, and yeah, it's very, very common. It's not always every night, but it's certainly important to address it because it's going to affect your sleep pretty much guaranteed.
So my GP,
Yeah.
It just goes right past her. What practitioner can I consult?
Call our office. So Nirvana Naturopathic Medicine. We have, they should be here. There's a couple of really great naturopathic doctors that focus in women's health at our clinic. One of them, Alex Smith, who should be here, wish she should be here. She would be a great fit for you too. But really how it works at our clinic is you call, if you're interested, you have a conversation with our great discovery call team, Melissa at the back there, and Laura. So they will take a call, essentially get your health history, see if you're a good fit, and then if you are a good fit, who you would be the best fit with, and then line you up to go see them. Yeah. And if
Sorry, I missed that last sentence.
They'll help set you up with the right practitioner
Right,
for
okay.
Yes, yeah. Which may or may not be me. I'm the one sitting in front of you, so but it may or may not be me. So, but anyways, peptides. There was a question about peptides. That's a huge topic, and it's also a very gray area. So I do love talking about peptides, but it is something that we're not technically able to prescribe as any clinician in Canada, not able to prescribe them. So it ends up being a little bit of a sticky topic to talk about. There's some use cases for certain ones are actually patented, so they're technically drugs, other ones are not. So broad area there. But most of the peptides that are used for sleep act on the hormonal system, so the growth hormonal system may or may not be something that, actually it's not something that I technically would recommend for the vast majority of people, simply because it's a very delicate system, and it's not something you just want to willy-nilly self-prescribe or test. You need to know, you need to do the testing first and have somebody walk you through how to do it. And that's the majority of the sleep-related hormones act on the hormonal system. Any other questions? Any other sleep topics that I didn't touch on at all that you guys were curious about?
How much is sleep difficulties
Yeah.
related to hormones.
Yeah.
Like, can be
Huge.
basically a problem with hormones.
So it goes both ways, right? So sleep disorders will affect hormones, and hormonal disorders often affect sleep. So it goes both ways. So what you need to figure out is which is the chicken and which is the egg, and treat the chicken and not the egg. Right? The egg will take care of itself, and it'll taste great. Well, that's true. Like if it's hormonal, there's other signs and symptoms. It's not just sleep, right? And if it's sleep, there's usually a good cause for the sleep, and then we can address that. So for the men's health perspective, I'll just talk about what I see all the time. It's a little different, but I see a lot of low testosterone and concerns with libido, and concerns with not feeling like themselves, and sleep ends up being a cornerstone of getting them back to a natural, healthy level of testosterone and feeling good. And oftentimes it's a primary sleep disorder that's the problem. So sleep apnea by itself can drop testosterone by 20 or 30%, which is a lot more than we're going to get from. So if we reverse that and get the testosterone go up 20 or 30%, that's more than you get from the vast majority of supplements, and with the exception of injecting with testosterone replacement directly, pretty much it's pharmaceutical. So that's just one example, but it goes both ways. It's a good point. Anyways, thanks for coming. I don't want to hold everybody hostage here. It's 7:10. Thank you so much. I apologize for being late, but if you wanted to come up and chat after, I'm happy to chat, take some additional questions, and then I'm assuming we have a couple cards to hand out, maybe? Do we? If you wanted to call the office, it literally would just, obviously you can talk to Melissa or Laura at the back. They're also probably better at fielding questions about what we do as a clinician, as a clinic, because they can talk about every clinician's kind of niche and where they best fit. Okay? All right. Thank you.
Thank you.